Okay, good morning. I'm going to explain about a case history. So, first, I'm going to start with adults, and then, if I have time, we will go on to peds. So, case history. First question I'm going to ask someone, that's an adult, is why they're here. So, what brings you here today? And usually they'll say, my wife says I can't hear. So then the other questions that I have to ask medically are, how long has this been happening? Most people, it's been years and they don't do anything about it. But if it's a sudden thing where they just woke up and all of a sudden they couldn't hear, that's significant because any kind of a sudden hearing loss like that could be an autoimmune thing. And as we talked about before, it is something that needs to be treated right away. So, how long has it been happening? Is there any family history? Anyone else in your family that has a similar problem that can lead us to something like, is there otosclerosis? Is it something genetic? Next question we would ask is there any ringing in your ears or buzzing? That's called tinnitus. So that's the next thing that we would ask. That's important. Noise exposure. So what type of environments do you work in? I had a lady the other day. She had high frequency hearing loss. She was fairly young. And I said, oh, do you have any noise exposure? She goes, no, I was a teacher. So we proceed. She definitely had some kind of a noise notch on her test results. And as we got to talking later, she proceeds to tell me that her husband's in a band. And he's been in the band for their whole marriage. And so she goes to his shows and she participates in the events. And there you go. So somebody thinks, oh no, I'm not in a noisy, I don't work in a noisy situation, but yeah, going to your husband's concerts all the time, that could have been the reason. You're young, but you have a hearing loss, and that's most likely where that's coming from. Dizziness. So I need to know, is there any dizziness? Do you have any lightheadedness? Those are things that are super important to know. Family history we talked about, noise exposure. Do both of your ears seem like they're the same? So that's important. Do they feel that they have a unilateral hearing loss? Do you have a better ear? Most people go, oh, I don't really know. I said, well, do you always favor one ear on the phone? Oh, yeah, I do always use my right ear. And when I lay my head down on the pillow on my one ear, I can't hear anything. So that's another way. But many times people don't know, and that's good. If you have a hearing loss, it should be symmetrical. So family history, noise exposure, dizziness, ringing in your ears. Those are all the things that you want to ask an adult. Those are important things. As far as peds, it's a whole different story. Obviously, you're talking to the mother. What brings you here today? Most of the times they're going to say they're not speaking. So I have concerns about their speech and language. That's almost always why I will see them. So then you get into, what was your pregnancy like? Any complications? Were they premature? Did they have to be admitted to the ICU? Did they have extended stay in the hospital? All of these things are important for audiology history and history whenever you see your kids with speech. Did they pass the hearing screening? So they're going to go, I don't know. Well, in all states now, they are screened before they leave the hospital, and I'll show you on another video how one of the ways that they do the screening. So they are screened, and the parents will go, well, I don't know. On their discharge summary, it will say what's one of the boxes that they have to check off is if they pass. If they didn't pass, they would have to be told, and it would have been reported to the state, and they would have gotten a letter from the state if they didn't follow through on another evaluation. So that's really important. Did they pass the hearing screening? I'm not really sure. Well, did you get a letter? Were you born in a hospital? So did you give birth in the hospital? If you didn't and you gave birth at home or in a birthing center, they make you still go out and have that hearing screening done, because I've seen babies that were born in birthing centers and they have to have it done. All of this is monitored and recorded by the state. So the state does monitor it, it does follow up, and they will send the parents certified letters. If they did not pass, they will find them and the letters will follow them until they get follow-up. So that is tracked and registered in a big portal. For the kiddos, is there a history of ear infections? And that's obviously something you want to ask the adults too. Ear infection history, do they seem like they're responding? Do they follow instructions? This is where you can kind of weed out if it's maybe more of an autism thing rather than an actual hearing loss thing. Is that sort of, those sort of questions. Even whenever you go out to see them in the waiting room, do they turn to their name? Do they look at you? Your evaluation starts the minute that you see the child. Looking at how they behave, looking at how they act, all of those things are important. So for the parent history, you want to know if they're involved in any services through early intervention, through the state. Do they have therapy that comes out to the house? All of these things are super important for you to know in the aspect of hearing and in the aspect of just developmental things. When you see kids that are under 3, you may be the first professional that really looks at their developmental history. So it's very important that you pass them on to the proper person. You're usually going to be their first point of contact. So that's really, really important. So family history, history of ear infections, birth history, and their responsiveness. Those are the biggest things that you want to know from the kiddos. So that's case history, and we'll do the testing in a little bit.